let you know when it's time. But good afternoon and welcome to UnitedTV. My name is Kemal Erkan. Today is May 23rd, 2025. The May is almost over. Hopefully summer is starting. Just to kind of give you a heads up, with all the travels that I have in the last 3 weeks, it's been a little bit tough on me. So little ear infection, a lot of cough coming maybe on the way. So I know on the live we won't be able to do much with that, but later on Ethan and Ali are going to be able to cut them off. So I'm just apologizing in advance. Although it was a lot of work in the last 3 weeks, but it was extremely productive. As we have given updates for the 28th Eurasian Economic Summit, that was held in May, the second week of May, May 6th through 8th. And this was my first time. I'm a Marmara Foundation member, but as the Eurasian Economic Summit, it's the major event for us, and I just didn't know how big it was going to be, honestly, how many people were going to be able to attend, and like knowing more than 800 people witnessing, more than 800 people joining us, and from 43 different countries. We opened the summit with President Erdogan's message, and also President Aliyev from Azerbaijan, his message. They weren't able to attend, but I can see them in the future joining for the future years. So incredibly well attended. Just to give you an idea, like speeches from 10 plus former presidents, including 11th Turkish president, Mr. Abdullah Gül. And we were actually able to have a smaller group lunch meeting with him. It was a different experience for me, and also part of being the host. I give the advance notice. Me being the kind of in the host side of this event, having Nobel Prize winner Dr. Aziz Sancar was an extremely meaningful. I think it was kind of rewarding in a way, the way that we had. I was from day one involved from his travel arrangements, and also being able to spend some time with him there in Istanbul. It was a different experience. You don't meet with the Nobel Prize winner every day. So the other person was from the highlights for me was Dr. İlber Ortaylı. He's one of the most well-known, I think maybe one of the best historian in Turkey, and he was there. He's from actually my school, my college. I mentioned that a couple times before. I went to the oldest university in Turkey, political science faculty of Ankara University. So it's about 160 years old now, and he's from same school. So being able to connect with those individuals were extremely good. Now, for me personally, I was assigned as the U.S. representative of the Marmara Foundation. And for those who may not really know much about the non-government organizations, there are so many NGOs, but not all of them are ESCO accredited by ESCO, which is United Nations. So United Nations recognizes only certain NGOs, and Marmara Foundation is one of them. I was also, kind of speaking about myself is not, I get a little embarrassed, but there was a reward that was given, and we shared that in our social media. And I do really appreciate what this event has contributed. And our goal is to have connections for what we have done in United Medical ACO, and being able to take this to other countries who are less developed, and then see if we can actually, while we are helping them, if we can actually increase our business and then go into new markets and do the new service line. And that's one of the main focus for my speech at the event. And I see a lot of opportunities for us. Now, our second update is the Turkish Fest in Chicago. United Medical is one of the sponsors. Unfortunately, Anil is not able to join. I was just see, like, he's one of the organizers of the event, so I'm sure he's swamped. And I was hoping that if he can just jump in and then just give his own update. But this is happening in Chicago, I believe this weekend, right, Ethan? Mm-hmm. So Ethan thinks that I can read all those from this system. I can. So it's going to be, I believe, their second one, and I really want to be there next year. Today, Susan Anderson is going to help me in the studio with our questions. Right now, you guys don't see her, or you won't see her, but you'll hear her voice. But I'm also kind of telling her now that I think it would be great if we can actually attend this event next year. So the other interesting thing happened for me was just yesterday. I had a meeting with House Minority Whip Catherine Clark and the U.S. Congresswoman Sarah McBride. As you guys know by now, that Sarah and I, we are good friends, and we supported her from day one. Even before she knew she was going to run for this office, I was pushing her to run. And now she's there, and now she's making impact in the position that she's in. And one of the greatest things that I know, what I see with Sarah, is trying to go beyond what her scope in terms of what people are expecting from her, just because of her own background. Rather than that, she's actually going for everyone and trying to answer everyone's issues rather than just one group of people. Why this is important is because being able to work on bipartisan bills is important. And in the U.S., in the Delaware Senate, while she was here, she was one of the people who did the most number of nonpartisan bills. And I think she's hoping to achieve that in the U.S. Congress. And the Rep Clark being with us, and it was a pretty intimate meeting. There was only 5 guests other than Sarah and Catherine. There was another event that they had before, but one of the questions that I had for her, for Catherine Clark, was what her perspective of what may be happening today in the White House in terms of more on the approach. I do believe there are certain things that President Trump is doing on the financial and economic side is going to be helpful for the United States in the mid and long term. I do believe that. And sometimes my Democrat friends don't like to hear that. However, we also know that things needs to be done in certain approach that's going to be reasonable, well received by others. And I personally do not like the casual kind of like getting out of what we would expect the protocol and just be way too casual and have some discussions in front of cameras with other countries or it's just like it's a different kind of like different thing that we are not used to in the politics. Now, I do have a background with my school. I was trained in a school that actually had almost 90% of the governors in Turkey are from my school. They had to be from my school until a certain point. So that government discipline is something that I always appreciate. And when that's not happening, maybe personally for me, I may be alone on this one, but I really don't like that. This doesn't mean that what's being done is going to be beneficial. So hopefully, but then my question to her was, if Democrats take over next time, are we expecting the same type of approach? Because now it seems like most people are kind of liking these. There are some people, answering these. We believe in government, having secrets not available to everyone just from the security reasons. But now everything is being open. It exposes us to certain things, and hopefully, things are going to settle with Trump's administration. But she she was able to kind of give me a different perspective. How actually, when they work directly with them, that's not how it is. But sometimes in front of cameras, it's more. So maybe, Trump loves his shows and he likes his ratings, and then if it's a boring meeting, no one is going to watch. Now, I'm hoping that that's just it, but there are a lot of things needs to be done, and hopefully we wish the best for the country, and otherwise, it really doesn't matter who the president is if they're not doing the right thing for us. And I personally believe that I'm not as pessimistic about Trump as other people. So that's my take. Now, we're going to start our questions and answers with Susan. Susan is a little bit nervous today. I don't know why. She's one of the people that I admire the most. The way she speaks to us, the way she writes things, and she's the most proper person I have ever known. And maybe that's why you are looking for perfection, Susan. So how are you doing?
I'm doing well, Kemal. Thank you for having me today.
Of course, and thank you for helping us today. We can start with our questions.
So, Kemal, I am really curious. Coming out of the Eurasian Economic Summit, there's renewed urgency to make sustainability central to all industries, especially healthcare, a sector that consumes enormous energy and resources while also responding to climate-driven health crises. Why is sustainable healthcare such a pressing issue right now? And what does sustainable healthcare really mean beyond the environment?
So, sustainability is whether or not we can keep doing what we are doing today, right? So, everything that we are doing today had been established in the past 60 years ago. Now, when Medicare first was introduced, it was I think in the 60s. People didn't know that they were going to live this long. So the cost is one of the biggest issues in terms of the sustainability, because people are, I think it's a great achievement, and I did mention this in my speech last week, like for people to be having a better, higher life expectancy. I want my mom to live for another 50 years. So, this is maybe not 50, but it's possible that she can do another 20 years. That's great. She'll be 94 if she does that. Now, 30 years ago, 74-year would be kind of like on the other side of the edge. Like we wouldn't be shocked if someone dies at age 74. Today, we say, hey, such a young age to die, right? So with that, what I see is we have to address those issues. So it needs a major upgrade. So, and that's probably one of the reasons that I'm actually kind of, in a way, supporting what Trump is trying to do in healthcare. But we'll get into that. But this is one of the issues. The other problem is the having social inequities with social determinant of health and understanding difficulties, financials, housing, security, all the others, healthcare, literacy. People really don't have those at the same level. And now, what I believe in time with the future, in the future, with technology improving and others, things are going to change. I don't know if it was your first and two or the both questions we can
Yes.
answer. So from the infrastructure to the sustainability and what's beyond environment is what's coming today is actually I just read this morning Elon Musk had robots available. I think if I'm not mistaken, he said 5,000 or maybe 10. I don't know if you saw that, and I should have a screenshot of that, but I'm gonna just check very quickly. For those who already know what I do during the getting ready for these things throughout the day, throughout the week, I have a lot of screenshots. But the thing was, we'll have not just in healthcare, but we'll have changes in almost everything. Now, you remember our discussion the other day, like the writers, people who write books, right? It's obsolete. So this information was given to us 2 years ago. True?
That is true.
So, and at that time, I didn't really understand at the level that I understand today. Now, people will have robots helping them with the AI, enhanced AI supporting these things, and they can be almost independent. So for a person who has to live in a nursing home because there's no family member, but they have enough financial means, they can actually live in their own condominium instead of being in the like with this situation. Or someone who may have special needs, we can utilize this. But then, how this is also advancing us to a point where it is getting us to a point. How quickly we are able to get to the information, how quickly we are able to run through the information, and what we do with Oracle and the smart AI portion of the system. Like, we change the way that we do document today in the exam rooms. You remember when you build United Medical Clinics, you bought these big arms in the exam rooms to make sure that we have good eye-to-eye connection, eye contact with the patients. You
Yes.
spent a lot of money for that,
Yes,
right?
I did. Yes.
I say you because Susan actually was in charge of all these. And not everyone wanted to do that. Other practices didn't want to invest, but we believe that having this eye-to-eye, eye contact is important, meaningful. But EHR, with the way that it was traditionally, was dismissing this, and we were just looking at the computer. And if I'm like now, if I'm not having an eye contact, if I'm looking at the camera, and if I'm still talking to you, it's going to be an awkward conversation. So worse than this was happening in the exam rooms. And with Oracle Health, we were able to change that. Now, why we were able to not do it before? Because it needs infrastructure at a higher level. It needs technology at a better level. It needs resources, and Oracle has those. But it also needed the foundation of the HR, and then what Cerner has at that point. So that's how we were able to kind of complement those things to make something better out of it. And those things are going to happen that I see. I'm, as you know, I'm a very optimistic person. Sometimes I'm too optimistic, but things are going to be very different in a good way. So, and we are going to see those changes. Like someone who's not able to remember getting their medication, just think about it, with the chronic illnesses, there's some device at home that just does it for them. It's not just having pills and in the pill boxes, right? So we have different things happening already today, different devices, and I think that's going to all be different. And while we are doing all those, we have to be accountable and we have to be able to pay. So one of the issues as you are running these entities with me is like, do we pay enough for Medicare today to live until age 92 and then have hip replacement, having a triple bypass, having a dialysis and still be 82. Medicare is not designed, and the payment structure is not designed for that. So if you don't change it, we are going to pay either way, but we are going to pay with huge deficits in the government budget and then not getting enough things, so then taxes will be increasing, or we are going to be individually accountable and then start paying more and then be prepared for living longer. So that's how I see it.
What do you see are the economic benefits to making healthcare more sustainable?
Well, right now, the way that we have CMS budget is 4.5 trillion, and CMS doesn't have 4.5 trillion. Now, just to put 4.5 trillion in perspective, that's 4.4 times the country of Turkey. Is one part of our government administration's offices, 4.5 trillion. Okay. So, and it doesn't have enough money. It's being subsidized by the taxes. So when we look at the savings and why it's important for things being more economic and also being more accountable, knowing that what we are paying today, and if the rate that we have and if the rate that we are going right now, in 5 years, things are going to be extremely different and difficult. So we are providing, healthcare benefits, and we contribute some, but we may not be able to do it. Medicare may not be the same Medicare 5 years from now. So that's why having these expenses, we are not looking for more expense. We are looking for prevention that actually helps us to get us ready for sustainable stuff. Right? Someone at 74, let's go with that person. So if that person is not getting the routine stuff done at their final stage, they may be getting a very costly colorectal cancer that could have been avoided if they had their regular colonoscopy. So sustainability, in my opinion, the way that we are supporting the sustainability, it's not going to impact the cost in a negative way. It's going to actually get us ready. Hey, we are going to be able to prepare better. So like if you are preparing for a marathon, like you can't run at the last minute, right? So this is like a lifelong marathon, and you have to prep. So otherwise, things are going to be difficult for us.
So, pardon me.
Excuse me. Go ahead.
So globally, development banks and institutions are aligning with green principles. How does this apply to healthcare? And how do the global economic institutions view this change?
We are on our question 6.
Yes.
So being ready for these.
Sorry.
Now, the one of the things with altogether when we look at these on the global level, things are changing from focusing more for the entire globe versus focusing on the countries. Like this is one of the things that President Trump said, America first, right? So what does it mean? So you have to actually kind of keep staying in the country and then take care of the country first, and then if you are contributing for other world or health organizations or like other like IMF type of organizations, World Bank type of organizations. So they may not want to contribute as much as they do today. And the United States is probably the biggest contributor for those. So what you'll be seeing is those changes, those countries who are benefiting from them, they have to put their own weight in there, so then they can actually stop expecting everything from us. So that's what I would say.
Oh, makes sense. So from Scandinavia to Southeast Asia, some countries are using bold strategies to align sustainability with healthcare policy. Are other countries successfully integrating sustainability into healthcare?
So not at the same level. And the statistics on this one, Susan, is going to be misleading because, right before we went for the Eurasian summit, we were analyzing the expenses of healthcare expenditure for each country. And I just realized when they say we have the highest number, that's not true, because we are not comparing apples to apples. I mean, you are a number person, so I mean, you are really good with numbers, and you would appreciate this more than anyone. So what I see, for example, is when you have a social government, social health care, and then like my mom, when she had her surgery, I mentioned this in the last couple of sessions, we didn't pay anything.
Nothing?
Nothing. Like whatever her Medicare was able to covered everything. So, well, if it was done here with the conditions that they have there, that could have been the cost could have been easily $200,000 to $250,000 here, and there will be some out-of-pocket expense on those. So when we have those comparisons, especially with the European countries, forget about it, because they are subsidized numbers. It's not reflecting the actual cost. You see what I mean, right?
Mm-hmm, mm-hmm.
So it's not. It's just the like if the government wants to subsidize those and then make the charges lower on those, they do it. So we don't have that. So one thing people really need to understand is, especially traveling, and I met at least 20, 22 different countries, some level of government officials in the Eurasian summit. So US and the rest of the world. It's like, when we say less developed, more developed, maybe developed, in some countries, the time where we are, how much we advance, it may be 100 years. It may take 200 years for some countries to catch up with where we are. So now we sometimes don't appreciate that here as much, but that's the truth. Until you go out of your way, and then not out of your way, but I think everyone should try to travel at least a couple times in their lifetime early on to see these countries. I mean, if you have kids, they should definitely have some time in these less developed countries. The life is going to be different for them, because what we have here, like the level, we got so bored that things became like a freak show, because we didn't have those issues that other countries were having. So then we had those, I say freak show before this administration. Things were bad. Like, what we value from the family, from the tradition, all of a sudden, like all we see is cross-dressers on TV, in White House, everywhere else. Well, we respect everyone, but we don't need to promote everyone, right? So again, respect and protecting them is one thing, but focus was different because we got bored. We are way too high, and the gap is too high. So do you think like China? Well, you have some Chinese connection. Well, I mean, if you don't mind me saying that.
I
So
don't
your
mind.
daughter, I didn't think about this answer just now. She may actually, I don't know if she has been in China before.
She has not
She was
been
born
to
and raised
China.
here.
Correct. She
Her-
was born in
Her
America.
family, though.
Correct. Both of her
Well,
parents.
if you go to China in the rural area, that's 300 years ago. Okay, where is in U.S. In terms of access to technology less than New York in any of the rural areas of United States? None.
That is correct.
The standardization, uniform ways of doing things in every state is actually in the rural areas. Sometimes it's better because you have to share that with less people. So your internet may not be the best in New York, but then you may have a better internet in Rehoboth, Delaware, or Dover, Delaware. Now, in those countries, the problem that they have is there's a group that's small, that's very advanced, but then there's like 1.3 billion people. They don't have access to certain things that we have kind of like standards here.
We are very fortunate.
Yep.
So, also, sustainability also depends on the smart use of technology. You were mentioning the internet and access. From how we use power to how we manage patients. How does innovation support this transition?
So remember our surgery center. So I'm so glad today you are actually part of this discussion because a lot of things that you do in the operationally involves with these. And we are building a new surgery center. And we bought one 10 years ago. When we bought that surgery center 10 years ago, I did a reference call for Oracle on Wednesday. And if I'm not mistaken, they are still using this prospect client paper in the surgery center. So since we took over American Surgery Center, even if we didn't have the actual proper EMR setting for the surgery center at that time because we use our outpatient EMR, we just start utilizing that as our main hub and everything. If we couldn't, document it, so it would be, if it's on paper, it would be scanned, but we didn't let people create paper charts. Now, from that, we are 100% electronic, and scheduling is like we have remote situations, and then I have schedule available to me. I can see patients who, like, in fact, when I was doing the reference call, I shared the screen that we have it in the lobby for the tracking board, and it's a live screen. And I did it from my business office, and then boom. So one patient was discharged, and then they could see that with the patient ID, like our internal ID, so it doesn't identify any patient information because anyone can be in the lobby, right? So, well, that wasn't there before, right? So, how much time they spend to get the information. Imagine like what we do with Oracle. And I mentioned this because next week, Seema Verma, Executive Senior Vice President of Oracle, going to be with us. And with the seamless exchange, if we have a patient registered in our system, I can get their information if they were in California, if they were in a different health system. It doesn't have to be with our power chart. And I can pull that information into my chart. And before, imagine how we were able to get that information before. We weren't. So how much that increases the efficiency, timeliness of the care is the day and night. So it's not comparable.
No, it's very interesting.
Yeah.
I remember when I first started working
Right.
with you, and it has changed drastically.
Yep.
So no country can solve climate-related health issues alone. What role does international collaboration play, and why is international collaboration so important here?
So we have borders on the maps, but we do not have borders in the air. In the when you look at the continents of North America, there's Mexico, and there's United States, there's Canada, there's Greenland. Alaska used to be, but now it's a state, right? So now you have borders and you have passports, but then you have the same thing for the climate-related issues. Like, can you actually have? You can go to that other side, pollution. You have to stop here. So this is why the collaboration is a must. You can't do those things like. You are in a neighborhood and then you keep your house. And let me give you an example. I had this situation, and you probably know this. I take care of my yard and a little bit obsessively, and then neighbor doesn't do it, right? So what happens when there's a storm? The things from their side used to come to my side, and that was a huge issue for me. So yes, we do have. There was an iron fence, but then things would go in between. And there still is. So unless they take care of their side, nothing is going to help. Now, if Anna is watching, she would appreciate this. From her husband's business, I take care of the mosquitoes in my property. 5 other homes, they don't. Do you think I'm going to be able to protect my own unless they all do it together? Because mosquitoes don't have borders.
Nope.
Right?
Correct. You can't stop them from flying across the iron gate. Just yesterday, a major healthcare bill passed the House with deep implications for public coverage and the future of healthcare financing. Let's talk about the new legislation. What just happened in the House?
So this is the one big, beautiful thing. I wish that I can do a good Trump impression, but I can't. I tried this. I'm going to actually work on it, Ethan, so maybe we can use it in the... Can you make it?
No.
So, well, this is where you'll find me supporting, in a way, very, very carefully though, what Republicans are trying to do. Medicaid has 0 patient accountability. Medicaid is for patients who live under the poverty level. So, for example, you, I believe, utilize our company insurance, and you have a copay when you go to your specialist. And I know it's $50 because when I went there last time, it was $50, and then insurance pays the rest. I have an accountability and responsibility financially. Yes, I do have a job, but at the same time, I need to feel that this is not an entitlement, but this is something that I should be responsible for, accountable for. So Medicaid doesn't have this. And people don't even try to find jobs, by the way. That's a huge problem. And then if we pay an average $700 a month, the cost of the health insurance for us. And Medicaid for state is probably $700 to $900 a month. So just think about it. This is a huge, huge expense item. The healthcare-related health and social services, 1/3 of the budget of every state and the federal government. So Medicaid is a biggest part of that. If we don't have patient accountability, Susan, when we started the Accountable Care Organization discussions in 2009, 2010, I had the diagram with 4 different main elements, core element of the accountability, and that one of them is the patient. And many insurance companies or government entities, they dismiss that from day one. Now we know that it's not sustainable anymore. So it's sustainable comes into the picture. So if we had a $3 copay for a Medicaid patient, because we know that some of our Medicaid patients come to us with nice phones, nice, decent cars. That means, or some of them smoke, they spend a lot of money on different things that you and I don't. So why can't they pay $3 for a copay? Why can't they just try to find a job? You cannot find enough people to employ. Why can't we actually have more people available to us? So this is why also I tell my Democrats, friends in Democratic Party, like, hey, we don't have to be, fight with everything that Trump is trying to do. If there is a reasonable approach where we know that this is going to benefit us long term, we have to be on that side. So now there's also this one big beautiful bill. So is the Medicare cuts by 500 billion. I just mentioned to you earlier, CMS budgets is 4.5 trillion with a huge deficit. So if you don't make certain cuts, and where the money is being spent is not necessarily your office visits. It's outrageous hospital charges, outrageous. Like, there's no reason that we should be paying 6-7 times more for a gallbladder surgery just because it's done in the hospital settings, right? So, well, the cuts are going to help and put everyone maybe shake everyone up a little bit to kind of, hey, can we do this in a different way? Do we have to have this gallbladder in this hospital? In our surgery center, the cost is 1/6. Why can't we actually have the prevention available to those patients and they can identify these issues early on? Now, for example, we change our anesthesia services after the 2 months of difficulties with the prior subcontracted people. When anesthesia was subcontracted, we didn't have full access to what they wanted to do with us. Like, we didn't know what their schedule is, who's going to come, who's going to go. It was just like we were at their mercy. Today, you hire 3 anesthesiologists, 1 MD, 2 CRNAs, and some per diem people to support. And you know what we are working on, what that made us to actually do today, change our way of doing things in the past. Because in the past, anesthesia was pushing us to cut the cases at a certain time. Well, I have a full-time anesthesiologist now, so if Dr. Erkan sees a patient at 2 p.m. on Tuesday in his office, that can be done, can wait for 1 day, I can now do that in the surgery center next day in the afternoon if they need to do some testing and everything else. Just think about that. So why we wouldn't go out of our way to make these financial benefits that's going to be for us, for the government, for the taxpayers? Like, why not? Instead of just looking at 500 billion cut, but what are we cutting it from is what it is. Like, one thing that's, I find it very disturbing, at least being in the business, and I didn't tell you this one yet. So, Christiana Hospital hired Governor Mayor's wife to run the emergency department of the hospital. So now the first lady of Delaware is in charge of Christiana Hospital's ED. So Christiana Hospital is suing the state, by the way, for the healthcare expenditure cost-related stuff, right?
That's interesting.
So with the HB 350, and then now they hired the wife of the mayor, the new governor, Matt Meyer. I mean, am I the only person who sees a huge problem with this, or is it is it acceptable? That I don't know.
Sounds like a conflict of interest.
Well, very, very much so.
So the bill that you were talking about does include many revisions from Medicaid to private insurance rules. Can you break those down for us? What is the biggest health care changes in this bill?
So the work requirements for Medicaid, those states who didn't actually expand their Medicaid program with the ACA coverage, they are going to be getting higher fundings. Some states did expand them, so then they were costing more. So now they're going to actually, I guess, promote those other states. Gender transition care. I think this is the surgery as well. It's removed from the ACA coverage.
100% or just for those under 18?
Um, I believe 100% because
Okay.
under 18, I don't know if that's even available.
I'm not sure.
No, I don't think it's available. So this is for adults, and the Medicare cuts at 500 million, and then there are some rebranding and expanded at as choice plans for the ICHRIs, and the student loan is one of the other things. The loan for forgiveness program, which again, like not every student was able to benefit from it. So why would we have a forgiveness if they benefited from this? Whose money is being forgiven by whom? If you didn't pay for it, right now I'm gonna pay for those in taxes. So now it's cutting those. I mean, this is financially is a reasonable and impactful, meaningful. In my opinion, if I was in the Senate or the Congress, I would just say yes to these. So I'm sure there are some details that's maybe not available yet, but that's what I would do.
And so there's been a really big reaction from the healthcare community. What have you seen that reaction to be?
Well, the reaction is going to be, remember, like, why when we have the healthcare expenditure issue in Delaware, when there's this committee that HB 350 proposed, who's suing the state of Delaware is the nonprofit hospital, because it's going to hit their revenue. So for those who may not be actually, who may not catch this before in our past episodes, Christiana Hospital's last 5 fiscal year profit, not the revenue, the profit is $1 billion. So 5 years, $1 billion. And yet they're still unhappy with oversight on their expenses because they want to be able to pay the CEO $4 million. She used to make $1.4 million 3 years ago. What triggered her to get that type of increase? They paid their former CEO $4 million after he left. Nonprofit, I mean, I can do that in the for-profit if I'm the one paying, but nonprofit is benefiting from the public sources, public resources, and our taxes are being subsidizing those expenses. So that's where the problem starts. So they are not going to be happy because they're all benefiting.
So after everything we've discussed, from green innovation to political upheaval, what is the overall message? And what is your final message for viewers about today's healthcare landscape?
So, I mean, again, one of the things that I want us, United Medical and United Medical ACO, to focus on is the sustainability of healthcare, and what we started with the Eurasian Economic Summit, and then actually elaborate that in our business model. So this can be done at the excuse me. So these are going to be cut, so I'm okay. I hope my mom is not watching, so she gets so sad when I cough. So what I see is that we have to kind of focus on resilience of the system itself, equity, equality, make things available for people who really need. Like Medicaid is a really important program for us if it's utilized properly, because there are so many people who don't necessarily know that they have Medicaid. They don't know their benefits. We have on one of our Medicaid managed care programs, I think 35% of the patients didn't even see us yet, and they didn't see anyone else. I mean, think about it. They don't know what they have. So that means, one, they may need it for prevention-related things. Two, they may have emergencies in different places. They may have other benefits that they can get from that program itself. Their insurances have so many different modules that it supports the patients. So I see those, and I want us to focus on those. I want us to have a good standard on the telehealth guidelines, and to make sure telehealth it stays where it is, and we just make it better with the integration to the HR and others. So, and this is gonna this is gonna happen only. This is gonna happen only if we work with our elected officials at the state level, elected officials at the federal level, and that's why, like, I went to that meeting yesterday, because I want this second person in command in the Congress from the Democrat side to hear some of the issues that we have. Instead of like maybe having, I'm not saying anything that they do, but maybe they are making certain things like just an ego fight, like ego, and versus, hey, it may not be that bad what they are trying to do. Let's see if we can actually make that better. So working those pieces all together, and then knowing that AI is going to be a game changer. So I think we need to get better at. Remember, you and I, we talked about this one yesterday. Just, I mean, not like you knew that you were going to be with me today, but we have to advance the available AI modules to us today, not just in healthcare, but for also in business. And because time is everything, so we can save a lot of time and make things more efficient economically, and that's going to help the sustainability. So that's what I would say. So we have our Bariatric Friday starting now, and Dr. Erkan, I'm sure, is listening to me in the cafeteria of United Medical. So we are going to start with him and then discuss the support group. So thank you for being with us, and stay united. Bye-bye. There, so you can let me know when it's time.